Bristol Health. I'm your host, Dr. Kam'mwamba. As always, this is a program we talk about different health issues. And today we are here to talk about waterborne diseases. And as always, I'm always joined by host. May you introduce yourself, madam?
Martha Sito, nice.
So, my first question is, what do people mean when they say waterborne diseases?
Okay, waterborne disease is illness caused by pathogenic microorganism spread through contaminated water.
So, when we say by the person that's got a waterborne disease, what do you explain to what happens to their body?
Okay, sometimes people caused by waterborne disease, they can know by she can suffer, she can have vomiting, diarrhea, yeah.
So, do you know how a waterborne disease is transmitted to a person?
As I said, it can transmit through contaminated water by ingestion. Ingestion contaminated food or water. Can also by inhalation. Can also spread. Can also spread by direct contamination of water.
So, can you tell how can a person suspect or think that they have a waterborne disease? What are the symptoms that a person should take out if they think they have waterborne disease?
Okay. The common symptom of waterborne disease is vomiting and diarrhea. Sometimes can also have skin, eye, ear problem.
So when a patient gets a waterborne disease, what is the long-term effect that can happen to their body?
Okay, long-term infection. There are so many long-term infection. Example, it can damage organs like liver, kidney. It can also cause chronic disease like cancer.
So
and it can cause congenital development in children. Like disability, learning disability. Yes.
So like when a patient comes to the hospital with a waterborne disease, so what is the process for like how do you treat this patient?
Okay. If patient come to the hospital with waterborne disease, it can be treated according to size and symptom which patient presents. If patient present with diarrhea or vomiting, give him or her ORS or mafwis. Can have mafwis.
So can you tell us what are the main waterborne diseases and like how are which waterborne disease different from each other? Can you tell us the examples of waterborne diseases and how are which waterborne diseases different from each other?
Okay, we have many examples of waterborne disease. We have typhoid fever, cholera, hepatitis A, E. coli, dysentery.
So out of these examples, how can you like differentiate like someone has cholera or like someone has this disease? How can you differentiate between two diseases?
Okay. We can differentiate. Waterborne diseases can also divide into four, which is water washing disease, like example. And water washing disease, it can also we can add typhoid fever, an example for water washing disease.
So can you describe how do waterborne disease affect children?
Okay. Waterborne disease affect children can cause serious complication or sometimes death. It can also cause as I said, cognitive development. Yeah. Like learning disability, slow milestone like walking.
So can you tell us what are the preventive measures for the patient, but someone can take to avoid getting HIV? How can they prevent from getting people? How can a patient how can how can a patient prevent from getting waterborne diseases?
Patient can prevent through proper hygiene, drinking or using well water, not contaminated. Yeah.
So can you explain to us what are the main medication for people that have waterborne diseases and how do these medication help in the treatment of patients?
I'm not understanding. Come again on that question.
Oh, so what are the medications that people with waterborne diseases take and how do this medication help with the treatment of waterborne diseases?
Okay. Yeah, people with suffering waterborne disease, if he or she taking the medication, it can prevent from contaminating with waterborne disease, like waterborne disease can also lower immunity of a body. So if we give medication to people, it can boost immunity. Yeah, that can prevent them from waterborne disease.
So can a can a patient suffer from waterborne disease transmit transmitted to another patient or people go to them?
Yeah, it can transmit
Yes.
through contact. Yeah, if someone touch contaminated water and touch another person without washing hands, or she touch surface that contaminated with that is contaminated, it can also get that waterborne disease.
So for a patient that has a waterborne disease and receiving treatment, are there any precautions that we should take so that we should be well and also protect protect the people close to them?
Yeah, it can follow precaution measure like proper hygiene, using well water. Yeah, avoid touching surfaces that is contaminated with with that with other type of waterborne disease. Yeah.
So, for example, like a patient has been treated for a waterborne disease and they have been healed, and they have gone home when it turns out that they get a waterborne disease. So, how do you treat a patient like that? A patient has been treated for a waterborne disease. When they have been healed, when they like go home, when we get it, when we get another waterborne disease, how how do how do you go about treating that patient again?
First, when we go to that area to assess the environment, maybe sometimes she use improper water, or she use water that is contaminated, or she wash water that is not well. We assess that finishing and continue with other management. Yeah.
So, as in, what as it is, what are the main challenges that you face when treating patients with waterborne diseases?
Okay. We have so many challenges. As we know, waterborne disease is transmitted through contact with contaminated water. So if we person have dysentery, vomiting, and you are not wearing protective equipment, you can easily get that disease. It's also a many challenges that all that nurses can face that.
So, what is the main danger if a patient suffers from waterborne diseases is not treated? Like a patient suffering from waterborne diseases, but he or she decides not to get treatment. What is the main danger that can happen to them?
A person not treated, it can develop chronic illness. Let's say like cancer can also damage kidney, liver. That is chronic and it's unable to cure.
So, when you are treating a patient who has a waterborne disease, how do you evaluate the treatment? How can you tell that this patient has been healed, so that we can go home, or that this patient will stay here for some more time? How can you evaluate a patient?
Okay, if patient is cured, we can, before he or she going home, we can educate them how to prevent waterborne disease. By personal hygiene, proper hand washing, before he or she going home.
So, the patient will get waterborne disease. So, what is the required time for them to, like, after being treated, what is the required time for them to stay in hospital, or are they out after getting treatment, but we can just go home?
Okay, she can stay in hospital until he or she is cured. Because if he or he sent home before cured, it can also transmit to others. So it's better to stay in hospital, study until the patient is cured. Because waterborne disease, it can easily spread.
So, do any waterborne disease have vaccination treatment?
Vaccination treatment.
For any waterborne disease, or is medication the only treatment?
Yeah, like hepatitis A. People can also get a vaccine for hepatitis A.
Yeah.
And another one. Other example, I'm not sure if we have a vaccine. Yeah, but hepatitis C, people can also get the vaccine for hepatitis A.
So can you describe how do rainy seasons affect the prevalence of getting waterborne diseases?
Come again, question.
How do rainy seasons, when there's heavy rainfall, how will this affecting the chances of people getting of getting waterborne disease, and how can people manage or prevent it from getting waterborne disease during rainy season?
Okay, during rainy season, it has a higher chance that people can get waterborne disease because maybe you can touch running water that is contaminated. Maybe you can ingest that water, or maybe food you can throw and you take it back to eat. You can also get that disease. So to prevent it, people can advise not to use running water during rainy season. Yeah. To maybe you can use the water that is in the house, not to take water that outside. Yeah. Sometimes you can have many germs. Yeah, like organism. Yeah.
So can you also tell us how do you differentiate the treatment between like a child vaccine and an adult vaccine, or do they get the same type of treatment?
Okay. Treatment we give according to age and the weight of the patient. So adult and the children, it cannot get same dose. Yeah, you can differentiate it through age and weight. Medication is the same, but the dose is different. Yeah.
So what is the dose that you give to a child and the dose that you give to an adult?
Okay. Like we give me freeze feed for patient. Yeah. Sometimes we use the 70 mils per kg. Sometimes we use 20 mils per kg. Yeah, in children.
So can you tell us how does the having waterborne disease affect other diseases? For example, like a patient has malaria, or like we have HIV and AIDS, and also we get a waterborne disease. How is their body affected when they have with a waterborne disease and another disease? How do they how does it affect their body?
Okay, it affects their body because all the disease, malaria, HIV, and the waterborne, can lower immune of the patient. So patient is at risk of getting of having so many complications in the body. So we can we can manage all the disease by giving them proper medication. Yeah, to boost their immunity.
So, as a nurse that treats people with waterborne disease, how do you teach how do you, how do you teach people in community about the dangers of waterborne diseases and about the importance of preventing waterborne diseases?
Okay, we can teach them people by doing awareness campaigning, so we can educate them how to use water
Yes.
and how to use proper water and give them maybe chlorine to contaminate water before using it, and also educate them about hygiene.
Yeah.
Yeah.
Right. So we finally reached the end of our program. We learned a lot of things about waterborne diseases, as always has been your host, Dr. Kam'mwamba, our trained by.
Martha Sito.
Yes. So this was another episode of West Curve, and until next time, thank you very much.